This is a SIMMAN bronchial asthma station. In the beginning of the station, you will enter the cubicle. You will find the patient telling you, "Doctor, I cannot breathe." So when someone tells you I cannot breathe, you will tell him, "I'm sorry for that. I'm Dr. XX from this department. I'm just going to have a look at your monitor. You'll find the oxygen saturation right now is low, maybe below 90 at some points. Okay, I'm going. First of all, tell me, do you have any smoker cough?" He will tell you, "No, doctor, I don't have any smoker cough." You have to rule out COPD before giving any high flow oxygen. Okay. Right now you will tell the patient that I'm going to place a mask over your face to help you breathe. So please bear with me, and you will put the non-breathing mask over his face with 100% oxygen. Okay, the oxygen saturation will improve. How are you feeling right now? I'm fine, doctor. Start taking history from the patient, and you will tell him what happened. He will tell you he has this shortness of breath which started could be 1 or 2 hours before, and it has been getting worse. That's why he came to the A&E. Do you have anything else? Any chest pain, any chest tightness, anything else? No, doctor, but actually I am having bronchial asthma. So he will tell you that I'm having bronchial asthma, and he has been diagnosed with it like 10 years ago, maybe, or 20 years, whatever, and he's taking the blue and brown inhaler, but recently he just had upper respiratory tract infection. He was having flu-like symptoms, and you could figure out that this patient is having this exacerbation of the bronchial asthma because of the respiratory tract infection which he had very soon. Actually, the trigger can change. Sometimes it can be because of physical exercise, sometimes because of smoking, sometimes because of the home condition, whatever. It can change from one candidate to another and from one scenario to another. So right now you'll ask him like the PMH or the past medical history. You'll ask him, has this ever happened to you before? Definitely it has happened to him before because he's asthmatic, but not this worse. Okay, apart from what you told me, how was your health recently? It was absolutely fine. Do you have any other medical illness apart from the asthma? Any eczema, any hay fever, any high blood pressure? Okay, do you take any medications? Any family member diagnosed with any medical? And so speak about the lifestyle. Do you smoke? Do you drink alcohol? Do you do any physical activity? Let's speak about your home condition. Do you have carpets? Any pets in the home? May I know what you do for living? Then at some point you will examine the patient. So thank the patient and go to the examinations. You'll find the vitals are normal. The general physical examination is normal. Move to the chest examination right now. You'll examine the chest, and sometimes during the examination, like the auscultation, you will do inspection, palpation, percussion, and auscultation. While auscultation, you can hear some wheeze, and you will notice that the oxygen started dropping back again. So when the oxygen drops, this means that there is a problem in the breathing because you give oxygen already, and still the oxygen dropped. According to the AB, this means that there is a problem with the B. So now you will change the mask. You will give the nebulizer mask to put salbutamol in it. How much salbutamol? 5 milligrams salbutamol. Okay, doctor, assume. And the oxygen saturation may or may not improve. Even if it improved, the examiner will ask you, doctor, what's your next step if the oxygen didn't improve? You will give Atrovent 500 microgram in the nebulizer. Okay, what's next? If it didn't improve, you will give IV hydrocortisone 200 milligram. Okay, what's next? You will consult your senior and start magnesium sulfate IV 2 gram. Okay, what's next? You will give the patient IV salbutamol 250 microgram bolus. Okay, so this is the whole steps of the bronchial asthma. Usually the examiner will reach for you till the end point. Just he needs to ask you what's next, what's next, what's next, even if the oxygen saturation improved after salbutamol. Then move to the patient back. What happened? You had acute exacerbation of asthma. Why did it happen? I mean, pick up what's relevant in the history. You will tell him, for example, he had it because his upper respiratory tract infection, or he could be having it due to smoking, due to any reason which he gave you in the history. Okay, what did you do for me? I gave you Oxygen, I give you nebulized solution, salbutamol to dilate your airway. You will verbalize all what you have done. Okay, what's next? We will keep you for a while in the hospital to observe and monitor you, and we will guide you about the asthma. Like you will give him some signs or some general advice about the asthma. Okay, this is the whole station. One note, please, to notice. A very important thing is that this scenario sometimes change. How? Okay, sometimes he tells you from the beginning, doctor, I can't breathe. My asthma is killing me. Does this mean that the patient told you that he's asthmatic from the beginning? So after giving oxygen, you can expect that the oxygen saturation still is not normal. I mean, it can improve to 92 or 93, but still it's below the normal, which is 94. So this means that I need to do nebulizer or to listen to the chest right now, because now the problem is in the chest itself. So you have to listen to the chest, and I will hear wheeze. After listening to wheeze, actually, I will give the salbutamol directly. I mean, sometimes he give you asthma from the beginning of the station, and some other times he gives you the asthma in the middle of the station. Even if he give you asthma in the first or in the beginning of the station, and you give him oxygen, and the oxygen saturation improved and he became absolutely fine, you can improve any deterioration in the oxygen saturation of the patient in the middle of the station, or generally after telling you that he is asthmatic. Why? Because actually after telling you that he is asthmatic, this means that there is a problem in the B. Oxygen is definitely for the A, but if the oxygen giving oxygen flow is for the A. But if after giving oxygen still the oxygen saturation is not improved fully, this means that the problem is in the B. So this means that you have to listen to the chest right now. Okay?